Every step, sprint, or shift in weight relies on a single mechanical pivot. When the hip joint works, it effortlessly carries our center of gravity. But when that architecture fails, mobility, sleep, and your daily routine come to a grinding halt. Hip pain remains one of the most common and debilitating musculoskeletal complaints in the UK, often dictating exactly what a person can and cannot do on any given day. Right now, patients face an average NHS waiting time of 27 weeks for a hip replacement. That is over half a year of waking up in pain, waiting for a surgical slot. However, precision, evidence-based injection alternatives offer a route to recovery that bypasses the operating table entirely. Reclaiming mobility without surgery requires looking at the hip layer by layer. Once we identify the exact point of structural failure, we can immediately apply a precise, targeted therapy to fix it. We start at the inner cartilage, allowing the joint to glide effortlessly. It's the second most common site for osteoarthritis. As it progressively wears down, patients feel sharp morning stiffness or deep groin pain after standing. If the damage is severe enough, surgery works. Data published in The Lancet shows that roughly 80 to 85% of physical hip implants successfully last 20 years. But catching the disease in its mild to moderate stages allows for early intervention. Hyaluronic acid injections can restore necessary joint lubrication, while advanced targeted therapies actively support early cartilage maintenance. Addressing the friction early preserves these foundational mechanics and can significantly delay or even avoid the need to drill in a metal implant. Moving outward, we reach the natural seal of the joint. This is the labrum, a tough ring of cartilage that tightly secures the hip socket. This seal is under constant stress. Repetitive sports movements, structural impingement, or natural degeneration can easily cause a labral tear. This graph illustrates the stakes of arthroscopic surgery. Labral repair has a solid success rate, but labral debridement, clearing away damaged tissue, carries a massive 63.6% failure rate. Even successful patients face 3 to 6 months of recovery. Advanced injection therapies provide a highly effective alternative. We can introduce specific healing properties directly into the damaged area to manage the joint environment naturally. By stabilizing the hip seal with a needle instead of a scalpel, patients bypass those heavy failure risks and skip the months of debilitating surgical downtime. Finally, we reach the outermost structural defense of the hip. These are the bursa sacs, fluid-filled pockets that act as a mechanical cushion between your bones and tendons. When these sacs become inflamed, it causes hip bursitis, or greater trochanteric pain syndrome. A landmark 2024 network meta-analysis recently evaluated every major treatment option for this specific condition. This chart reveals cortisone's severe limitation. Relief peaks at 6 weeks, but vanishes completely by week 24. Conversely, targeted therapies are the most effective treatment, maintaining sustained improvement through 1 to 3 months, 6 to 12 months, and out to 2 full years. For outer joint padding failures, this clinical data is clear. We must shift away from temporary symptom masking and adopt multi-year, sustained recovery protocols. Every instance of hip pain represents a specific mechanical failure at a precise structural layer, requiring a tailored, architecturally mapped solution. We match the treatment directly to the anatomy, using cortisone to quickly calm acute bursitis flare-ups, hyaluronic acid to physically lubricate osteoarthritic joints, and advanced therapies for sustained healing of the labrum and bursa. This strategy shifts the entire patient experience. Instead of passively waiting in pain for a highly invasive procedure, you can engage in immediate, proactive healing. The standard one-size-fits-all approach to joint pain simply doesn't align with modern research. Evidence-based, non-surgical options exist right now to help you reclaim your mobility. At Harley Street Wellness, we specialize in this exact architectural approach to pain management, giving your hip exactly what it needs to heal.